Good morning. So today we have a patient in her early 40s, and about 10-15 years ago she had injections into her buttock. The injections were done in Florida, and over the ensuing years she developed chronic pain and masses not only in the buttock, but the masses actually migrated over her hip and now into her groin. So what we did is an MRI preoperatively to determine how much product there is and the location of the product. The location of the product can be basically in two areas: the fat and or the muscle. So in this case it is primarily in the fat. So what we can do is this ultrasound guided, where I can see exactly where it is in the operating room. Vaser assisted, that helps me melt the scar tissue, and then we use suction to remove not only the product but also the scar tissue around it. So I'm going to make three key incisions, one at the top of the buttock crack and one underneath each buttock to sort of access the entire buttock. And then I'm also, once I'm done with the buttock, going to flip her over to get rid of some of the product that's migrated to her hips as well as into the groin. So let's go to the operating room and I'll show you how we do ultrasound guided, vaser assisted, silicone and foreign body suction. So we got probably 10 minutes to the flip here.
Okay.
So this is the part of the specimen we removed, and this is the aspirate, or what we sucked out. And what we do is we strain it to get rid of any of the impurities, and then we try to just show you and show the patient what we removed. So when I'm running my fingers across here, you can feel this, what we call cobblestoning, which are the little pellets, the little beads of silicone here. So as you look closer and closer at this thing, you can see all these little silicone bobas, these little balls of silicone. She didn't have as much as most, because she was mostly scar tissue. And these are the large lymph nodes that we took out. You can sort of see for size comparison, very large masses there. So silicone removal and silicone lymph nodes. So we're done. First of all, we did the ultrasound. Second of all, we put the tumescent solution in. Third, we put the vaser in. And then fourth, we went in there and suctioned the product out, as well as a lot of scar tissue. The majority of this patient's buttock was actually scar tissue around the product, not necessarily product. The scar tissue just built up over the past 10 years. So there you have it. This buttock is much softer. It does have a couple little hard spots here and there, but the majority of the scar tissue is gone. The majority of the product is gone. I think she'll get a lot of symptomatic relief by this surgery. So there you have it. Thanks for watching. Please subscribe. We'll see you next time.